Welcome to the deep dive. Today, we're going to be shining a light on something you probably see every time you visit the dentist, but might not give much thought to.
Hmm.
Those blue lights used to harden fillings and other dental materials.
Oh,
Our mission today is to explore the fascinating world of light curing in dentistry.
right.
And our guide is an expert who can help us unpack the science, the technology, and the clinical considerations that make it all work.
It's really fascinating how something so commonplace can be so complex when you delve beneath the surface.
Absolutely. We're going to be diving deep into a research review article called Light Curing in Dentistry and Clinical Implications,
Oh, wow.
which will give us a glimpse into knowledge usually reserved for dental professionals.
Yeah,
By the end of this deep dive, you'll have a whole new appreciation for what goes on in that dentist chair.
you might even be able to impress your dentist at your next checkup.
Exactly. Okay, let's start with the basics.
Okay.
Resin polymerization. Most dental restorations today, from fillings to veneers, are made from resin-based materials.
Right.
But these materials don't just magically harden on their own.
Yeah.
They rely on a process called polymerization, where individual molecules link up to form a strong, solid network.
Think of it like building a chain, link by link.
Okay.
The individual molecules are the links,
Mhm.
and polymerization is the process of connecting them together.
That's a great analogy. And the dominant mechanism behind this transformation
Hmm.
is vinyl-free radical methacrylate polymerization.
Right.
It might sound intimidating, but the research article actually compares the methacrylate vinyl group to a compressed spring waiting to release energy and bond with its neighbors.
And to unleash that energy, we need free radicals.
Okay.
These highly reactive molecules are like tiny keys that unlock the potential for those springs to connect.
Mm.
They're formed through external energy sources like heat, chemicals, or, as in the case of light, curing light.
So light acts as the trigger, creating these free radicals that kickstart the whole polymerization party.
Precisely. And what's really interesting here
Yeah.
is that dentists have a lot of control over this process.
Mm.
They can influence the number and rate of free radicals formed by adjusting things like the composition of the resin, the temperature, and most importantly,
Right.
how long and how intensely they expose the material to the blue light.
So it's not just about shining the light.
No.
It's about understanding the science behind it to achieve the best possible results.
Exactly.
Now, before we dive into the specifics of those blue lights,
Okay.
let's take a quick trip down memory lane.
Right?
Believe it or not,
Mm.
early light curing technique actually used ultraviolet light.
UV light,
Yeah.
like what we use in tanning beds.
Yeah, that seems a little intense for the mouth.
You're not wrong. It was borrowed from the printing industry.
Oh, wow.
And while it worked, it had its limitations.
Mm,
UV curing was slow, the equipment was bulky,
right.
and there were understandably safety concerns about prolonged exposure.
It makes you appreciate how far we've come. I'm guessing that's why visible light curing became the preferred method.
Exactly.
Okay.
It's faster, more efficient, and much safer to
Mhm.
understand how it works.
Right.
We need to delve into the electromagnetic spectrum for a moment.
The electromagnetic spectrum, that sounds a bit complex.
It's actually quite simple.
Okay.
Think of it like a rainbow of energy, with each color representing a different wavelength of light.
Okay.
And just like different colors have different energies, different wavelengths of light can trigger different chemical reactions.
Hmm.
Figure 6 in the research paper illustrates this beautifully, showing the relationship between wavelength, frequency, and energy levels.
So it's all about using the right wavelength of light to activate the photoinitiators,
Yeah.
which are the molecules responsible for creating those free radicals.
Precisely.
And that brings us to those iconic blue lights.
Right.
The most common photoinitiator in dentistry is called camphorquinone, or CQ for short.
Uh-huh.
And guess what? CQ absorbs light energy most efficiently in the blue range of the spectrum.
You can see this in Figure 8, which shows its absorbance spectrum.
So those blue lights are specifically designed to hit that sweet spot where CQ is most receptive to energy.
Precisely.
That's pretty cool.
Hmm.
But you mentioned earlier that CQ has some quirks.
Oh, yeah.
What are those?
Well, for one, it has a slightly yellowish tint,
Mmm.
which can impact the final color of restorations.
Oh, I see.
Yeah.
So if you're getting a filling or a veneer, especially if you've had your teeth whitened,
Okay.
you wouldn't want it to have a yellowish tinge.
Exactly. This color limitation led to the development of alternative photoinitiators,
Right.
like Lucerne TPO and PPD, which have different absorption spectra, as shown in Figures 9, 10, and 12.
Mm.
These newer photoinitiators can help achieve more natural-looking results,
Okay.
especially for those seeking brighter smiles.
It's like a constant game of innovation, finding new materials and techniques to meet the ever-evolving demands of dentistry.
It certainly is. And this drive for innovation extends to the lights themselves. Over the years, we've seen a remarkable evolution in light curing technology, from those early UV units to the sophisticated LED lights we use today.
Speaking of those lights,
Yeah.
I'm curious to learn more about how they've changed over time. It
Mhm.
seems like there's a lot more to them than meets the eye.
There definitely is.
Yeah.
So, shall we start with the grandparent of visible light curing units?
Okay.
The quartz tungsten halogen light.
I've heard of those,
Mm,
but I don't know much about them.
yeah.
What were they like?
Well, imagine this. The very first visible light curing units were actually adapted from airplane lights.
Yeah.
Talk about durable and high emission.
Wow.
You can actually see how these QTH lights worked in Figure 13.
Oh.
Notice the bulky filters needed to control the heat.
Hmm.
This led dentists to develop turbo tips and boost modes to increase light intensity.
So they were essentially trying to make these lights more powerful and efficient, but
Yeah.
didn't that create some new challenges?
It did. Dentists started noticing that rapid polymerization, while seemingly advantageous,
Mm.
could actually cause internal stress in restorations,
Mm.
leading to cracks and gaps.
So it's not just about speed.
Right.
It's about finding the right balance between curing speed and minimizing stress on the material.
Precisely. And that's how soft start features were born,
Hmm.
which gradually ramp up the light intensity to reduce those internal stresses.
That makes sense. It seems like every step forward in technology brings new considerations and adjustments to the technique.
You're absolutely right. It's a constant evolution. And that's what makes this field so fascinating.
Yeah.
Now, while QTH lights were evolving, another contender emerged,
Okay.
the plasma arc light,
Right.
or PAC light.
Pack lights. Those sound pretty dramatic. What
Yeah.
made them so different?
Well, they used tungsten rods and xenon gas to create a spark and emit intense light.
Wow.
It was like a miniature lightning storm happening right there in the patient's mouth.
Hmm.
You can see a PAC light in Figure 16.
Wow, that's quite a visual. But I remember reading that they had some limitations as well. What were
Okay.
those?
One of the main limitations was their short exposure duration.
Hmm.
Early PAC lights could only maintain that intense output for a few seconds,
Right.
which wasn't always ideal for curing certain materials.
Hmm.
They also required specific tips for different photoinitiators, as shown in Figure 18,
Right.
which added another layer of complexity to the process.
So despite their initial excitement, they weren't the perfect solution.
Yeah.
What happened next in the evolution of curing lights?
Well, as technology advanced, PAC lights became more sophisticated, with electronic circuitry enabling longer and more controlled exposures,
Right.
as you can see in Figure 19.
Mm.
But around the same time, another light curing technology entered the scene, albeit briefly,
Okay.
the argon ion laser.
Lasers. Now we're talking high tech. I'm imagining something out of a sci-fi movie.
You're not far off. Figures 20 and 21 show you an argon ion laser and its spectral emission profile. While they held promise, they ultimately lost favor as alternative photoinitiators became more prevalent.
Right.
Their specific wavelength output wasn't a good match for the newer materials,
Hmm.
and they're also quite expensive.
So it's a good reminder that even seemingly revolutionary technology can become obsolete as materials and techniques evolve.
Absolutely. And that brings us to the light curing technology that has truly stood the test of time and continues to evolve.
Yeah.
The light-emitting diode,
Right.
better known as the LED.
LEDs. I must admit, I was a bit surprised to learn that they're used in dentistry.
Hmm.
I always associate them with things like TV screens and light bulbs.
It's a testament to how adaptable and versatile LED technology is.
Hmm.
It's small, durable, energy efficient, and incredibly long-lasting.
Right.
Plus, no filaments to burn out like those older lights.
So goodbye bulky equipment and hello sleek modern design. But it wasn't all smooth sailing, was it?
No,
Even LEDs had some early hurdles to overcome.
that's right.
Hmm.
First-generation dental LEDs faced a power challenge. Each individual diode had a relatively low output, so they needed large arrays to achieve adequate power.
Hmm.
You can see this in Figures 23 and 24.
Right.
Those early units were essentially clusters of tiny LEDs.
And those early NiCad batteries with their annoying memory effect didn't make things any easier.
Ah, yes, the joys of early battery technology.
Yeah.
But as always, necessity is the mother of invention.
Hmm.
And second-generation LEDs saw a major power boost,
Right.
thanks to high-power small footprint LED chips.
Okay.
Figure 26 shows just how much smaller and more powerful these chips became, dramatically reducing curing times.
And those longer-lasting NumH batteries were a welcome improvement as well.
Yeah.
But the story doesn't end there, does it?
No, it doesn't.
What about third-generation LEDs?
That's where things get really exciting. Third-generation LEDs brought us multicolored chipsets,
Hmm.
meaning they could emit both violet and deep blue wavelengths.
Okay.
Figures 28, 29, 30, and 31 illustrate these multicolor arrays.
So what was the benefit of having multiple wavelengths?
This innovation allowed dentists to cure a much wider range of materials,
Hmm.
including those using the newer photo initiators we talked about earlier,
Yeah.
like Lucerne, TPO, and Ivocern.
Right.
A great example is the Velo light, which has a broad emission spectrum, as shown in Figure 32.
So it's like having a Swiss Army knife of curing lights,
Right.
able to handle all sorts of materials.
Yeah.
And let's not forget those sleek new designs.
Right.
I remember seeing some really ergonomic pencil-style lights that look much easier to maneuver than those older gun-style units.
You're right. Figure 34 shows the difference in form factors.
Hmm.
And of course, battery technology continued to advance as well.
Right.
Lithium-ion and lithium polymer batteries became the standard, offering greater durability and even longer usage time.
It's amazing how each generation of LED lights builds upon the previous one, constantly pushing the boundaries of what's possible.
And it doesn't stop there. We even have batteryless curing units now,
Wow!
like the Demi Ultra, which utilizes an ultra capacitor for extended lifetime and super fast recharging.
Right.
And for dentists who need wide coverage curing without compromising intensity, there's the Valo Grand LED.
So much innovation. It's almost dizzying to keep up with all the advancements.
It is,
Right.
but it also highlights an important point.
Mm.
Not all curing lights are created equal.
Right.
And this is something I think our listeners should be aware of.
You're referring to those curing lights that are marketed directly to consumers online.
Exactly. While it might be tempting to buy a cheap curing light online,
Yeah.
it's important to remember that the clinical success of your dental restorations depends heavily on the quality and performance of the curing light used.
So a word of caution to our listeners.
Yeah,
Buyer beware. Don't risk your oral health for a bargain.
right.
Choose a curing light from a reputable manufacturer that has been tested and validated by regulatory bodies.
That's excellent advice. And it brings us to another crucial aspect of light curing
Okay.
that often gets overlooked: the clinical considerations that can impact how effectively those lights work.
That sounds like a great segue into our next topic. Before we move on, though,
Yeah.
is there anything else about the evolution of curing lights that our listeners should know?
I think we've covered the key points.
Okay.
The main takeaway is that light curing technology has come a long way and it continues to evolve.
And it's all driven by a desire to improve patient care and achieve the best possible outcomes.
Absolutely. Now, are you ready to explore those clinical considerations?
I'm all ears. All right, so we've covered the fascinating history of curing lights and how they work. Now let's dive into those clinically relevant factors you mentioned that can affect how well these lights actually cure dental materials. What's the first thing that comes to mind?
Well, one of the most fundamental yet often overlooked factors is the distance between the light tip and the resin being cured.
That seems pretty intuitive. I'd imagine the farther away the light is, the weaker the intensity, right?
Exactly. And as you might expect, this has a direct impact on the depth of the cure, especially in those hard-to-reach areas like the gingival margin, where the restoration meets the gum line.
Figure 35 actually shows this, visually comparing the power output of different curing lights at various distances. It really highlights how that distance can make a big difference.
It does. That's why dentists need to carefully consider the working distance when choosing the appropriate exposure time for a particular restoration. It's not a one-size-fits-all approach.
So even with the most advanced curing lights, a skilled dentist who understands these nuances is still essential. It's a good reminder that technology alone doesn't guarantee success.
I couldn't agree more. Another critical factor is light beam uniformity. Not all curing lights produce a perfectly even beam of light.
What do you mean by that?
Well, some curing lights might have hot spots and cold spots within the beam, which means some areas of the restoration could receive more light intensity than others.
That makes sense. Figures 36 and 37 illustrate this concept really well. You can see how an uneven beam could potentially lead to incomplete curing in certain areas.
Exactly. And those weaker spots could increase the risk of the restoration failing prematurely, which is definitely something we want to avoid.
Absolutely. So for our listeners out there, how can you tell if a curing light has good beam uniformity? Is that something you can even ask your dentic about?
It's definitely a valid question to ask. Dentists can use special devices to measure the uniformity of their curing light's beam. They should also prioritize lights from reputable manufacturers that have a track record of producing high-quality, consistent beams.
Good to know. Now, switching gears a bit, I've heard a lot lately about the potential dangers of blue light exposure. Is that something our listeners should be concerned about when it comes to dental curing lights?
It's definitely worth discussing. Excessive exposure to blue light, especially at certain wavelengths, can be harmful to the eyes. And as we know, many dental curing lights emit light right in that potentially hazardous range. Figure 38 actually shows the maximum hazard level for different wavelengths of blue light.
So, what precautions are taken to protect both patients and dental professionals from this potential risk?
The most important precaution is wearing proper eye protection. Those orange, blue blocking glasses that you often see in dental offices aren't just a fashion statement. They're crucial for protecting your eyes from cumulative blue light damage.
That's good to know. I have to admit, I've always wondered why those glasses were orange. Now it makes sense.
And if your dentist doesn't offer you protective eyewear, don't hesitate to ask for it. It's your right and your responsibility to protect your vision.
Absolutely. Speaking of responsibility, what about the responsibility of dentists to maintain their curing lights and ensure they're working properly? It's not something we've really touched on yet.
That's a great point. It's easy to assume those lights are always functioning at peak performance, but just like any other piece of equipment, they need to be monitored and maintained.
So, what are some of the things that can affect a curing light's performance over time?
Well, things like light guide degradation, debris accumulation on the tip, and even the repeated heat sterilization process can all impact light transmission.
I see. So, how can dentists make sure their curing lights are consistently delivering the right amount of light energy?
There's a handy device called a radiometer that measures light intensity. Figure 39 shows what one looks like. Dentists should routinely check their curing lights with a radiometer to ensure they're working properly and adjust their exposure times accordingly.
It's like a regular checkup for the curing light. Makes sense. Now, before we move on to the next topic, is there anything else about maintaining curing lights that our listeners should be aware of?
Yes, infection control is crucial. Curing light tips and light guides need to be properly cleaned and disinfected between patients to prevent the spread of germs.
That makes perfect sense. But I've heard that some infection control barriers can actually reduce light output. Is that true?
It is. Research has shown that certain barriers can significantly block light transmission, potentially affecting the curing process.
So dentists need to be mindful of the type of barriers they use and adjust their techniques accordingly. It's all about finding that balance between infection control and optimal curing. Now, I know we've talked a lot about the technical aspects of light curing, but you mentioned earlier that training is also an important consideration. Can you elaborate on that?
Absolutely. Proper training for both dentists and dental assistants is essential for using curing lights effectively. It's not as simple as just pointing the light at the material and pressing a button.
So, what are some of the key things that dental professionals need to be trained on?
One important concept is light attenuation, which refers to the reduction in light intensity as it travels through a material.
So, if I'm understanding correctly, this means that thicker restorations or those made from materials that absorb more light will require longer curing times.
That's exactly right. And this is especially important when dealing with indirect restorations like crowns and veneers, where the light has to pass through the restoration itself to reach the cement underneath.
So it's like playing a game of light hide and seek. The light has to find its way through those materials to reach the target.
A great analogy. And to address this challenge, dental manufacturers have developed dual-cured cementing systems.
Dual cured, what does that mean?
It means that these cements can be cured both by light, A and D, by a chemical reaction. So even if the light curing isn't 100% effective due to attenuation, the chemical reaction will kick in and ensure the cement hardens properly.
That's clever. It's like having a backup system to make sure the restoration is securely bonded, even if the light can't reach every nook and cranny.
Exactly. But here's where it gets even more interesting. Research has shown that the degree of conversion, which is a measure of how much of the material has actually polymerized, can vary depending on the curing mode.
Meaning whether it's cured primarily by light or by the chemical reaction.
Precisely. And some studies suggest that light activation generally results in a higher degree of conversion compared to self-curing alone.
So while dual cured systems provide a valuable safety net, light activation is still the preferred method whenever possible.
That seems to be the current consensus. But ultimately, the best approach depends on the specific clinical situation and the materials being used.
It seems like there's a lot for dentists to consider when it comes to choosing the right materials and techniques for light curing.
Absolutely. But all of these considerations are ultimately aimed at one goal, providing the best possible care for patients and ensuring the long-term success of their dental restorations.
That's reassuring to hear. Now, I know we've been focusing on the benefits and technical aspects of light curing, but are there any potential risks or downsides that our listeners should be aware of?
There are a few things to consider, and one of the most important is the heat generated during light curing.
Heat. I've never thought about that. How much heat are we talking about and why is it a concern?
Well, the amount of heat generated can vary depending on the type of curing light, the intensity, and the duration of exposure. But even small increases in temperature can have a significant impact on the delicate tissues inside your teeth, particularly the pulp.
The pulp. Remind me what that is again?
The pulp is the innermost part of your tooth containing nerves and blood vessels. It's essential for the health and vitality of your tooth.
Right, of course. So how does heat from a curing light affect the pulp?
Excessive heat can cause irreversible damage to the pulp, potentially leading to pain, sensitivity, and even tooth loss in severe cases.
That doesn't sound good. Is there a certain temperature threshold that dentists need to be aware of?
Historical research suggests that a temperature rise of just 5.5 degrees Celsius can be a tipping point for irreversible pulp damage.
Wow, that's a pretty small margin. So how do dentists make sure they're not overheating the tooth during light curing?
There are a few things they can do. One is to choose curing lights with lower heat output. They can also adjust the light intensity and exposure time to minimize heat generation. And some curing lights even have built-in cooling systems.
It sounds like a delicate balancing act, trying to cure the material effectively while also protecting the tooth from excessive heat.
Exactly. And this is where continued research is so important. We need to better understand how different factors, like the type of light, the exposure time, and the thickness of the remaining dentin, can influence the temperature rise inside the tooth.
So there's still more to learn about how to make light curing even safer and more effective. What about the effects of heat on the soft tissues in the mouth, like the gums? Is that a concern as well?
It can be. While most of the research is focused on pulp temperature, there's growing concern that excessive heat from curing lights could also damage the gums.
I can see how that would be a concern. The gums are very sensitive.
They are. And there have even been case reports of patients experiencing burns on their lips or gums from light curing.
That's alarming. So what steps can dentists take to minimize the risk of soft tissue damage?
One promising technique is air cooling. Directing a gentle stream of air towards the tooth during light curing can help dissipate heat and protect both the pulp and the surrounding tissues.
It's like having a tiny fan keeping things cool.
Exactly. And other strategies, like increasing the tip distance or reducing light intensity, can also help reduce heat generation, but they come with trade-offs, potentially compromising curing depth and effectiveness.
So as with most things in dentistry, it's all about finding that sweet spot. Now, before we wrap up this part of our deep dive, is there anything else about heat generation and its potential risks that our listeners should know?
I think the main takeaway is that while light curing is a remarkably effective and safe technology, it's not without its potential risks. Dentists need to be aware of these risks and take appropriate precautions to protect their patients.
It sounds like there's still a lot of ongoing research in this area, and I imagine there will be even more advancements in the future to make light curing even safer and more efficient.
Absolutely. As our understanding of the science behind light curing continues to evolve, we can expect to see even more innovative solutions to address these challenges.
That's great to hear. Well, I think we've covered a lot of ground in this segment, from the importance of light tip distance and beam uniformity to the potential risks of blue light exposure and heat generation. It's clear that there's much more to light curing than meets the eye.
There definitely is, and I hope our listeners have gained a new appreciation for the complexity and the importance of this technology in modern dentistry.
It's amazing to think about all the science and technology that goes into something as seemingly simple as hardening a filling.
It really is. And you know what makes it even more fascinating?
What's that?
The fact that it's constantly evolving.
Speaking of evolution, it makes me wonder what the future holds for light curing technology. What kind of innovations are on the horizon? What are researchers working on right now that might change the game even further?
Well, that's a great question. One area of active research is focused on reducing or even eliminating the heat generated during light curing.
Hmm.
Imagine a curing light that could harden materials instantly without any noticeable temperature increase. That would be a game changer, especially when it comes to protecting those sensitive pulps we talked about.
That would be incredible. Are there any other areas of research that you find particularly exciting?
Another area that's generating a lot of buzz is the use of light to stimulate tissue regeneration.
Tissue regeneration. So we're talking about going beyond just hardening materials to actually promoting healing.
Exactly. Researchers are exploring how different wavelengths of light can be used to stimulate cell growth and accelerate the body's natural healing processes.
That sounds like something out of science fiction. Are there any practical applications of this technology in dentistry today?
It's still early days, but there's some promising clinical trials underway. For example, some researchers are using low-level laser therapy to accelerate healing after periodontal surgery or to stimulate bone regeneration around dental implants.
Wow, that's incredible. It makes you wonder what other possibilities might be unlocked as we continue to explore the power of light in dentistry.
It really does. And it's not just limited to dentistry.
Oh,
Light-based therapies are being explored in various medical fields, from wound healing to cancer treatment.
it's amazing to think about the potential of this technology to transform healthcare as we know it.
Absolutely. It's a rapidly evolving field, and I'm excited to see what the future holds.
Well, I think we've covered a lot of ground in this deep dive.
Yeah.
We've explored the fascinating science behind light curing, traced the evolution of curing light technology, and discussed the clinical considerations that dentists need to keep in mind to ensure the best possible outcomes for their patients.
We've also touched upon the potential risks associated with light curing, like blue light exposure and heat generation, and highlighted the importance of ongoing research to address those challenges.
It's been a truly enlightening journey, and I hope our listeners have gained a new appreciation for the complexity and the importance of light curing in modern dentistry.
I hope so too.
So, as we wrap up this deep dive, is there any final takeaway message you'd like to leave our listeners with?
I think the most important message is to never stop asking questions. Be curious about the science behind the treatments you receive, and don't hesitate to discuss any concerns you might have with your dental professional.
That's great advice. And as always, we encourage our listeners to stay curious, keep learning, and explore the world around them with a sense of wonder.
The more we understand about the world, the better equipped we are to make informed decisions about our health and well-being.
Well said. Thank you so much for joining us on this deep dive into the world of light curing in dentistry. It's been a pleasure learning from you.
The pleasure was all mine.
And to our listeners, until next time, keep exploring.